So the female reproductive cycle is, now we will tell about the female reproductive cycle. Female reproductive cycle, one is ovarian cycle and one is the menstrual cycle. Ovarian cycle occur in the ovaries, okay, and menstrual cycle occur in the uterus, okay. You will both of them occur at the simultaneously, okay. You have to, we will discuss this, okay. So first of all, ovaries, uterus, uterine tube, vagina, mammary gland, we have discussed this all thing, okay. First of all, for example, this is the hypothalamus. Hypothalamus, from hypothalamus the uh, gonadotropin releasing hormone GnRH releases and goes to hypophyseal portal system, to the anterior lobe, to the anterior lobe of pituitary gland, okay. And from there are two hormone release, FSH and LH, okay. When these hormone release, they work. FSH stimulate FSH stimulate the actually FSH stimulate the ovaries and induce that, due to which the development and maturation of the primary follicles and primary oocyte becomes started, okay. And when LH increases, LH help in ovulation, stigma formation and ovulation. You have to remember this, that LH work on stigma formation. We will tell what is stigma formation. And due to LH, ovulation occur. FSH induce development of primary follicle, okay. You have to remember this thing. And another, when the, along with the HH, after the, when LH releases, after the LH, there is a, the primary follicle convert into the corpus luteum, and the corpus luteum release the progesterone progesterone and estrogen. Another thing is FSH also stimulate the cell to release estrogens, okay. And estrogen, progesterone and estrogen work on the endometrium to increase their thickening, to increase their thickening, and vascular supply, blood supply, etc. Okay, so let's come here and discuss one by one. Now about the ovarian cycle. First of all, we will tell what is ovarian cycle, and then after go to the uh, menstrual cycle, okay. So ovarian cycle, there is the, for example, I have already tell that there are the primary oocyte, development of the follicle, okay. FSH also occurs. Now the thing is the ovulation, corpus luteum, we will discuss everything, okay. First of all, the proliferation of follicular cell, then formation of zona pellucida, and then formation of theca folliculi, development of theca folliculi. So primary follicle increase in the size. First of all, primary follicle, this is primary follicle, they increase in the size, as, and into organized in the connective tissue organized into a capsule like structure, that is called theca folliculi, okay. And after the theca folliculi convert into two layers, one is the theca externa, one is the theca interna. And the theca externa and theca interna have two main functions. For example, androgen are secreted by the theca externa, and these androgen, when androgen are released, okay, the androgen, the theca interna and theca externa, okay. Now we will discuss, okay. So the androgen are released, due to theca, the androgen are releases from theca externa and convert into the estrogens, okay. So this is the function of the theca. The growing follicle produce estrogen, actually the growing follicle produce estrogens, okay. And the vascular erythema also produce erythema. Now ovulation occur due to LH. When LH surge occur, there is a stigma soon appear, swelling. Stigma is a swelling and a vascular process, we will show in the image. For example, now come here, this is the hypothalamus. From hypothalamus, GnRH hormone is released, and this GnRH work on the pituitary gland, and from pituitary gland the gonadotropin hormone release and work on the FSH and LH. Now FSH have different role. One on the primary follicle. Primary follicle become grow and mature, okay. And when these growing, the growing follicle also secrete the estrogens. These estrogen work on the endometrium to increase their vascular supply, blood supply, etc. Okay. And now this another thing is the androgen. Androgen release, but androgen release, and they convert it to the estrogen by theca interna. Okay. And estrogen is also released by the interstitial gland of ovary. So you have to remember that androgen are released, one from the mature follicle, another function the theca interna convert androgen into estrogen, another is the interstitial gland of the ovaries. Okay. When the LH is released, LH release here, so here form it the stigma formation. Stigma is the avascular stigma. So the avascular spots is a stigma. So this stigma is can easily ruptured, and the oocyte from here can ovulate. When the oocyte is ovulated, it goes from the ovary, it goes to the fallopian tube, uterus, and the ampulla. If the fertilization occur, so the process of development occur. If the fertilization not occur, it move, and the estrogen which due to estrogen the endometrial lining now come here. When the ovulation occur, there is the remaining process are the theca folliculi convert into the corpus luteum. Okay. And this is the corpus luteum, and this corpus luteum secrete progesterone and estrogen. These progesterone and estrogen work on the endometrium. Progesterone is actually increasing the progesterone is actually maintain the endometrial lining, to not to would diminish it, and estrogen increase their blood supply, their thickening, etc. Okay. So this is all about this. But if the fertilization not occur, this corpus luteum degenerated. When this degenerated, the progesterone and estrogen level decreases. Okay. Progesterone and estrogen level decrease, due to which endometrium become denatured and lost their function, and they become lost and bleed in the during menses. Okay. So this is about the ovarian cycle. Now come here and see here, this is the actually the oocyte. Okay. And here you can see this is the follicular cell, this is the antrum. How the antrum is actually I will see here the space between the follicular cell and zona pellucida. For example, this is the zona pellucida, and there is the layers, not zona pellucida. Here is the actually see here zona pellucida is so much here. This is the follicular cell. Follicular, one is the theca externa, one is the theca interna. This is the actually externa. Now come here the theca interna. So this is, for example, this is the follicular cell of internals, theca interna. Okay. And the space between them, there is a space created. This space is called antrum. Okay. And now come here, this is actually the oocyte, nucleus of the oocyte. This is the oocyte. Around them there is a layer called zona pellucida. This is called zona pellucida. Okay. And along with the zona pellucida, they ovulate. Okay. The remaining things are they remain in the oocyte. Okay. Now another thing is the metal schemers and ovulation. MIT metal schemers. Metal schemers mean mid pain. Actually in the female there is a pain or during menses. Okay. But there is also another pain that is called metal schemers pain or ovulation. Okay. If you know that there is a mid pain, and at that mid pain you have to know that this is the time of ovulation. Okay. And another thing is during ovulation, constant in the lower in the pain in the lower abdomen, and shift drop of basal body temperature. Your basal body temperature slightly drop. Okay. This is the symptom of ovulation. Another is anovulation. Anovulation, if the ovulation not occur, that is called anovulation. So what is the anovulation? When female do not anovulate, inadequate of release of gonadotropin, when GnRH is decreases, so the FSH and LH level decreases, and LH also decreases, due to which the ovulation not occur. And ovulation not occur, so the normal fertilization of the female can't, normal fertilization of the female become disturbed. Okay, so you have to remember this. Now about the we will tell about the corpus luteum. Okay, and how the ovulations occur. Now come here, the corpus luteum. Corpus luteum, shortly after ovulation, ovarian follicle and theca follicle. There are two follicles, ovarian follicle and theca folliculi. Okay, so the LH influence ovulation. Corpus luteum created progesterone and estrogen are released by these to prepare endometrium for implantation. Okay, now come here to the again. For example, this is the surface of the ovary, and here is the follicular cell, primary follicular cell, and also the primary oocyte. This primary oocyte is present here, but here is a stigma developed, and this stigma is the avascular. Okay, this is avascular area, and due to which this area, the primary oocyte rupture this area and move and ovulate from this area. When they ovulate, along with the corona radiata, the follicular fluid also move out. Okay, and when this fluid move out, there is the movement. This is the fimbria of the uterine tube, follicular. So they move like a sweeping movement. They attract this thing, these attract this and move into inside, due to which they move inside to the fallopian tube due to the movement of this. Okay, and they move inside, and after at the ampulla there is the fertilization occur. Now come here to the hormonal secretion. Another is the menstrual state. This is the LH surge. When LH surge occur, menstrual state start from this. When LH surge occur, okay, what occur at the LH surge? There is the oocyte ovulation occur at LH surge. Okay, so I have already discussed that there are three hormones: LH, FSH, estrogen, progesterone. Four hormones. GnRH release the LH and FSH. Okay, stimulate the anterior pituitary gland to release LH and FSH. LH and FSH work. For example, first of all, the FSH level is increases at the first time. LH is normal. Okay, not just like so much increases. LH is increased, but during ovulation, the LH surge occur. LH surge, LH so much increases. The LH hormone so much increase, due to which ovulation occur, and FSH is little bit increased. The estrogen level also increase. Okay, at this level, these all things are increases, but LH are so much increases. Okay, now estrogen are remain if the and progesterone after progesterone is actually after the ovulation. Progesterone level increases because the function of progesterone is to maintain endometrium. No, if there is no fertilization, the degrade menses and bleeding occur. Okay, progesterone level decreases and menses and bleeding occur from the womb of the female. Okay, another is the menopause. Now what is menopause? Menopause is the 48 to 55 old endocrine stomach somatic body physiological change, termination reproductive period. For example, climatic change, climacteric. Okay, physiological change for the menopause after 48, or if you use endocrine, there is the endocrine and somatic body. Okay, in the ovaries, they become physiologically changed, and due to it they cannot function well. Okay, another menopause, if you use contraceptive, due to which the bleeding occur. If your menopause come after that, after menopause, the bleeding also occur from the female that use contraceptive. So the best thing to prevent pregnancy is to use the physical barrier. Okay, now we will tell about the menstrual cycle. Again, that what is menstrual cycle. Okay, after that we will go on to the transport of gamete. So come here about the menstrual cycle. Menstrual have I have already discussed, but now endometrial cycle. Now first of all, there is menstrual phase, proliferative phase, luteal phase. Okay, and menstrual flow 4 to 5 days. The blood discharge to the vagina combine small pieces of endometrium tissue in eroded endometrial gene. Now proliferative phase. There is the estrogen secreted to the cell after 9 days. At approximately 9 days, estrogen secreted by these follicle thickening endometrium become thickening. Proliferative phase is the thickening of endometrium. Luteal phase. At luteal phase, function and growth of the corpus luteum. Progesterone produced by the corpus luteum, and this progesterone maintain the endometrium, functional endometrium. Spiral artery also develop venous network complex like direct artery. These increase. If the fertilization not occur, what will happen? The corpus luteum decrease, estrogen and progesterone fall, okay, and menstruation will occur. Now the ischemic phase. At the ischemic phase, oocyte is not fertilized, the spiral arteries constrict. Vascular changes occur in the body and long period venous stasis, patch ischemia necrosis will occur. Bleeding of the uterine lumen, 20 to 80 ml of the blood will also occur from the during the menses. Okay, so this is about the menstrual cycle. If fertilization occur, so how to identify that fertilization occur? Cleavage of the zygote, blastogenesis started, formation of blastocysts. Okay, blastocysts began to implant in the endometrium at the 6th day of the luteal phase. Okay, our 28-day cycle, 20 days at the 20 day of the fertilization. Another is the HCG. HCG hormone is produced by the syncytial trophoblast. For example, there is a trophoblast in the trophoblast, and this trophoblast divide into somatic trophoblast and syncytial trophoblast. And syncytial trophoblast release the HCG hormone, and this HCG hormone work on the corpus luteum secreting estrogen and progesterone. So this HCG is the used for pregnancy test that you are pregnant or not. Okay. So this is all thing about the menstrual cycle and ovarian cycle. Okay.